So with that, Mark, let's kick this discussion off. And hats off to you for bringing together just an amazing group of providers from so many different disciplines to talk about what we can do to better support ourselves, our loved ones, and our clients if we work in this field. I'm real excited. So you want to give people a little bit of a taste of what we've got coming today?
Absolutely, Stephen, and we're glad that everyone could be here. And I appreciate you, Steve, for helping me put this together. And I appreciate all of our panelists and all of our attendees. The idea of this is that we should never wait until there's a health crisis, especially as the last year has taught us. We should never wait until there's a health crisis to make decisions, to know what's out there as far as services and resources to help us through our health journey, whatever our health journey is, from beginning through the aging process, through senior adulthood, or whatever you would like to call it. And it's so important to know what resources are out there, how these resources may be available to us. And as you listen to each presentation, think about how they intertwine in your life as it relates to your health and that of all your loved ones. And so we've grouped these presenters together in a way to kind of outline the journey that you may go through. And so today we're going to talk about planning ahead. That's the first segment, is the planning process, knowing what's out there, thinking ahead before there's a crisis. After that, we'll talk about healthcare resources. When we start to need care in the community, where do we find care? And then the next process is when we want to receive care in the community, whether it's in an assisted living community or at home, or how is that care provided to us? And so each of you can think as you go through this process, where you are in the journey and how some of these services can help. You'll be able to contact each vendor independently, each provider independently if you'd like. All their contact information will be in the end. So let's kick it off, Steve. Let's get right to it.
All right.
And so what we'll do, Steve, one more thing. So what we'll do after each segment, for example, the first segment is here on the screen. And after each segment, we'll do a brief question and answer session. Each presenter will have about 5 to 8 minutes that they'll be able to share their information. And then we'll look for questions at the end of that segment. So let's kick off the first segment, Steve.
Great. And what I'm going to do is I'm going to duck behind the curtain here. And it looks like our first 3 panel members are Melissa Wu, Ellen Platt, and Ali Saltani. And Melissa. And so let me stop sharing the screen so that we can get a better glimpse at who our presenter is. So our first presenter, Mark, is Melissa.
Yes, so our first presenter is Melissa Wu, Juris Doctor. She is an excellent, highly experienced estate planning, elder law, and guardianship attorney. Melissa Wu.
Thank you so much for the lovely introduction, and welcome everybody to this informative, great webinar. As the gentleman mentioned, I am a practicing attorney in Maryland and the District of Columbia. I'm very passionate about elder law and estate planning. In fact, so much that I went and got an additional LLM in elder law from Western New England College of Law. My story is very simple. I was in corporate law for quite a while, and my mom was diagnosed at age 58 with early onset dementia. So a lot of the planning and ahead and tactics that I'll share with you come from my own personal experience. So let's delve right into it. Why is planning for the cost of long-term care an issue? Well, first of all, it's how are we going to pay for it? The average cost of a nursing home or an assisted living facility is $6,000 to $12,000 per month. So we're going to look a little bit into the presentation of how we would finance those costs. But right now, let's turn to the essential estate planning documents. So everyone needs a will or a trust. What that does is that disposes of your property, sometimes with a trust during your lifetime, but most likely these documents are grouped into planning for afterlife. And so it's important to have a will or a trust so that you can dictate what the disposition of your property is going to be. But it's also very important to plan for incapacity. And so in doing that, you may want to execute a durable power of attorney, which gives a trusted person authority to take care of your finances when you're no longer able to do so. It's pretty simple. The other document is an advanced medical directive. And again, that gives a trusted person authority to make medical decisions after you are no longer able to do so. You can also sign a HIPAA release through your doctor, which gives a trusted person authority to access your medical records in order to make healthcare decisions for you. So you think about, how are we going to finance long-term care? We could use savings and private pay. You can have long-term care insurance, or you could use public benefits. So the goal in mind is to, when you're planning for incapacity and long-term care costs, to kind of go beyond the legal documents and figure out what the payment options are, which are very fact-specific depending on your family, your work history, etc. But the ultimate goal is to be able to preserve assets and then to apply for public benefits, hopefully at the end, so that way Medicaid picks up the nursing home bill. Who should worry about these long-term care costs? Well, it's really it's really falling, like a lot of things, on the middle class. Those with an income or savings between $50,000 and $1.5 million in assets. If you take the cost of a nursing home, which is, $10,000, $15,000 a month, those assets will be depleted very quickly without long-term care planning. And so we do planning with asset protection in mind. But let's take a look at some false assumptions. Again, cost of care is not expensive. A lot of people come to me and they'll say, I'm covered by Medicare. You're not covered by Medicare. That only covers 100 days of your hospital stay. And then after that, it either goes to private pay if you need long-term care. You have long-term care insurance, or eventually if you require a skilled nursing level of care, then you would get Medicaid through a nursing home. So health insurance does not pay for long-term care. Some other false assumption is I will never be in a nursing home. Back to my story, my mom, at age 58, even with her diagnosis, never imagined that she would be, at 70 years old, completely incapacitated in a nursing home. Another false assumption is my family will take care of me. We all have good intentions to take care of loved ones should they need a nursing level of care at home. But, it can be done definitely if you have home health aides, but you need to look at the cost of that as well. So we're looking at your retirement income, Social Security, pensions, annuities, in order to get your kind of financial ducks in a row, as well as your legal documents. And if you work with a elder law or estate planning attorney, you can certainly get those documents in place to avoid guardianship and just other issues. Like I said, you can get qualified for Medicaid, or some people can qualify for veterans benefits to help supplement. But, a lot of folks find themselves, being in a crisis situation where they saved, like my parents, their whole life, planned on retiring someplace, and, unfortunately, there's a diagnosis or something where the individuals can no longer, use that money for retirement, but it has to be earmarked for the cost of care. So we want to keep that in mind with our long-term care goals of being in a least restrictive setting, being safe, being physically and emotionally comfortable, having friends and family around us, continuous access to quality of life, to not be a burden on others, and have the ability to pay for care and the ability to leave a legacy. So that's why it's important to work with these healthcare professionals here, and work with an elder law attorney to assess your current financial situation to see if there is room to preserve assets during this process. And
Thanks,
if anybody has
Melissa.
any questions, I'm happy to take them.
We'll do questions right at the end of the segment after the
Very
three.
good. Okay.
But so please, if you do want to type in your question now, so you don't forget it for Melissa, and that way when we get to the end of the segment, Melissa or whichever presenter will be able to address your question right away. So Steve and I'll make sure we don't miss any questions. Thanks, Melissa. That's great.
Thank you.
One of the things I always share is that we have to have that conversation while we're still of sound mind and sound body, have the conversation with ourselves first of how we would want to be treated if we ever became sick, or what do we envision for our aging process? And don't be afraid to have that conversation then with your family. And then you take your estate planning attorney and they can put the pieces in place for you. That's a great use. And then the next friend I'm bringing up is a dear friend of mine, Ellen Platt with the Option Group. She's president of the Option Group and also a aging life care manager. And she would be a great resource in helping your family through the care process. So Ellen Platt with the Option Group.
Thank you, Mark, and
My
thank
pleasure.
you, Steve, for having us today. I'm Ellen Platt. I'm a geriatric care manager or aging life care manager with the Option Group. And we help families navigate longevity. We help them figure out what they need, help them plan ahead. And again, today we're coming from the perspective that there's a way that you can come up with plans ahead of time and educate yourself on options so that if or when there is a crisis, you already have some information in your pocket. You're not making a knee-jerk reaction, but you're making an educated decision about your care or someone else's care. So again, we're aging life care managers, and we are certified through a national organization. Some of you may have been on Steve's prior programs, and there were a lot with aging life care managers. It's a national organization, and if you need to find somebody across the country, that's how you would find them. And they are people with a minimum educational background that would be able to help you in the area that you're looking at. The next slide is the 8 core areas of expertise, and you may have seen this as well in the past from Steve's prior presentations, but basically care managers are looking at these types of things. We're at the hub of the wheel, we're in the center with the client and the family, and we're helping them figure out what they need to know as they're navigating their health care. So we're looking at health and disability. What's the clinical picture? Are there ways that we can be proactive with our health and be good, engage with our primary care physicians and really stay on top of medical conditions and also do some self-care. We look at the financial picture and make sure that we're doing some pre-planning there. We're looking at housing. Is the house that they're in accessible? Are they able to ambulate within the house? Is it supportive to their needs, or are their needs changing? And maybe they need something without steps, or maybe they need ramps to get into the home. We just look at each person individually. So we're collecting all this information. What are their psychosocial supports? Do they have family? Is family in town so that they can hop in and help take care of them? A lot of times care managers become the family, or they become the boots on the ground for the family who lives in another state or even another country. but we want to make sure that person is supported and that they can get the help that they need. We're looking at the local resources to be able to provide the help that they need, whether they're in home or whether they're navigating to a facility. We help them understand what the local resources are and what makes the most sense for them. We're doing a lot of advocacy, so getting benefits or entitlements, getting them services that they might need to keep them as independent as possible and functioning as well as they can. And Melissa talked about all the legal things that are really important to have in place ahead of time. Do they have their power of attorney documents? Do they have somebody who's able to step in and make decisions in the event they're not able to? We prefer they do that ahead of time when they're able to make these kinds of decisions on their own. And as care managers, we like to know, what are their wishes? What do they want? What kinds of treatment do they want? What kinds of treatment do they not want? So we're the ones that kind of can be that advocate for them and help make sure that their wishes are carried out. And we also get a lot of calls in crisis when people are in crisis mode. You know, obviously we'd like to be working with people ahead of time and help avoid that crisis, help avoid that hospitalization, help have that supportive network or that safety net underneath them ahead of time. But that doesn't always happen. Sometimes there's something that's just unexpected, or maybe somebody has delayed their decisions and it becomes the point of a crisis, and that's where we hop in. So we're kind of putting all those pieces of the puzzle together and figuring out what the person needs, and we're helping them navigate that complex healthcare maze and make sure that they have the highest level of safety, independence, and comfort. So these are a variety of services that care managers can help provide, whether it's home safety evaluations, cognitive screenings, doing education and training, creating that care plan that's supportive to the senior and the family, and monitoring it and tweaking it as we need to, because sometimes conditions change and they may need some additional supports. Coordinating medical care, coaching caregivers and family members, helping them understand the progression of a disease, or what they need to start thinking about, or what they need to start looking for. So we'll identify the resources and help coordinate those services, again, to keep that person as independent as possible and supported. These are examples of conditions that a care manager might work with. So not only do they work with people who might be aging, but they may have some kind of disability or injury or accident, or maybe they're going through some type of treatment that they need an advocate or somebody to help them navigate the care. So these are all the types of conditions amongst some others that care managers can help with. So thank you again for your time, and feel free to give us a call if you have any questions.
Thank you, Ellen. Great job. And, you know, hopefully our audience is already seeing how these pieces start to weave together and how we can weave in all these providers to help for better health outcomes. So many of us, when we think about the aging process, we think about, one of the first things we think about is, can we live in the home that we're in? And if we need to, can we modify that home? So one of the great resources in this community is HandyPro Builders. A good friend of mine, Ali Sotani, he's the leader of HandyPro Builders in the DC area, and they can do all sorts of different modifications to the home to make it safe. So I bring you Ali Sultani with HandyPro Builders.
Hi, good afternoon, everybody. Thanks, Mark, for putting the amazing group together. It's amazing how you managed to put all the pieces, as you mentioned, all the pieces together. And one thing I think everybody needs to take away from this webinar, it's never wait till the crisis happen, as you mentioned, Mark, before. So it's hard when the crisis happen. It's much harder to navigate and resolve the stuff. But if we do a plan ahead of time, we definitely will be in a better planning and aging in place, as you mentioned. So our company is, we do have home modifications for people with disability. And we do this very professionally. We are certified to do this. I myself, to give you some background about me, I have electrical engineering degrees. Also, I have civil engineering. I got my MBA from University of Maryland, and I've been in construction for my whole entire career life. So I've built a lot of stuff in my past life, and I've been doing this for about 8 years. We also have an occupational therapist, which is Melissa Brisler, that she's joined our team very recently, but we are very, very excited to have her because, as I mentioned, we want to do everything professionally, and we want to make sure we oversees everything and everything designed very well. Melissa, if you'd like to introduce yourself, please do.
Sure. Hello, everyone. I'm Melissa Bressler. I'm an occupational therapist, and like Ali said, I recently joined his team at HandyPro as their outreach manager. I am registered and licensed to practice OT in DC and Maryland. For the past 11 years, I have worked at a large outpatient clinic in DC, working with individuals who have experienced complex neurological conditions that have impacted their daily independence. I'm excited to bring my knowledge not only as an OT to HandyPro, but also my personal experience with family members benefiting from some of the products that we're going to introduce you to today. All right, so a little bit about HandyPro. We are a nationwide chain. Our local franchise is owned by Ali Saltani, and our full name is HandyPro of Washington, DC Metropolitan. He was actually awarded Franchise of the Year in 2020. So HandyPro provides a wide range of services, from small repairs, for example, changing out your doorknobs to levers would just make it easier access if you have some mobility or dexterity issues with your hands. It could be changing out the hinges on your doors to have them swing in the opposite direction. We also look at existing equipment and products you may have to see if they are still holding up and are safe for you. And we also do partial or full room modernizations to keep in mind your accessibility or a loved one's mobility concerns or needs.
Okay, so if we can go, we work with a lot of organizations as well. We work with a lot of government-funded programs as well. We work with Medicaid. There are a lot of county funded programs for people with disability and limited income. We are most of those programs, so we can navigate your customers, your clients, your patients, or if you thinking about yourself, we definitely can help you to see if you can be qualified for any of those. We definitely cannot qualify you, but we definitely can refer you to the right people so you can take the road from there. In the next slide, we will go over some of the generic jobs that we've done. So to tell you what it is and how you can tackle your home and make the home accessible and safe. So we will make a roadmap for you. So we do for your short-term and your long-term needs. So if you have a disease that is going to progress, so we'll see your needs today, and then we'll design those, and we will design it somehow that we can extend them or upgrade them to your future needs. As you see in this picture, so we can work from the entry of your house to see if you have any steps, any threshold that you need, and all the way to your bedroom and your bathroom. We do anything as far as ceiling lift, vertical lift, platform lift, and elevators, ramps. So as Melissa mentioned, nothing is small and nothing is big for us. So if you just need changing one doorknob or you need just installing one grab ball, we will be there. If you can have a next slide, please. So these are some examples of the grab bars and some accessibilities. On the left side, as you see, grab bars doesn't need to be very, industrial looking. You can choose any color you want and any shape you want. At the bottom, as you see, it's the toilet paper holder. that is grab bar rated. We can do modification to your kitchens, installing some stand-up poles or super poles with the pivot bars. And in the next slide, we have like more equipment that you can see. This is like the bathroom remodeling, the conversion of a bathtub, as you see on the left, make it as a shower and accessible, like a walk-in shower. We can do it different way that to keep you in your budget that you have in mind, or if you want to have like a nice and luxurious way to do it, we can do it as well. So either way will work. And the next slide will show some more lift options, ramp options in the slide. So you see different ramp. If you have adjusted small threshold, we can do it. We can install the aluminum ramps, wooden ramps. Also, we can do something it calls environmental ramp. So it's like a landscape ramp that it's just camouflage with whatever you have in front of your house. So it doesn't need to really shouting that this is a ramp. So again, we can work with any budget that we have. In this slide, as you see, there are two ceiling lifts, one portable, one stationary. That on the middle one, that the ceiling lift takes the patient from the bed onto the toilet and also into the shower, so that there's no transfer needed. And then on the right side, it's a similar regular custom curved stair lift for a house in Sterling that we installed. And we can do straight stair lifts. As I mentioned, we work with a lot of organizations, and we've been 5-star, 4.9 reviews on Google and other review sites. And we would love to talk to you, and we don't charge for estimates. So that the family and you don't have nothing to lose by getting educated and get to know what you have in front of you for the road that you want to go. Thank you.
Thanks, Ali. And Melissa, great job. Thank you so much. Does anyone have any questions for this first group of presenters? These services, so fantastic, the way that we see the picture developing of how we can plan to stay in our home, how we can have help through the option group to put the pieces in place, and how we can bring HandyPro in to modify that home and keep us safe and thriving where we are, if that's what we choose to do. Are there any questions, Steve? I don't see any.
None yet, but that's okay. At any point in time, you can
Absolutely.
put in a question or comment. And what a great first planning ahead panel there. The elder law, the aging life care, and the thing that we wish more people would do would be think about modifying their home so that they can stay there if there is a crisis. But now we're moving on to the next segment of panel, which is some really important and interesting healthcare resources that many of the people in the audience may or may not be aware of. And Mark, you want to take it away with bringing on our first panel member?
Absolutely.
There?
Thanks so much. And our first panel member is Kurt Martin with MedStar Health. Kurt is the Senior Director of Operations for Geriatrics for MedStar Health. And he's the leader of the soon-to-be opened Center for Successful Aging at MedStar Montgomery General Hospital. Kurt has served our country as a military person for more than 20 years. He looks young, it's hard to believe, but I give you Kurt Martin with MedStar Health.
Thanks, Mark. Yeah, so, at this point now, you've had the chance to meet with Melissa, with Ali, with Ellen, and you've made good plans, but now you need some help. You need some help with your healthcare. And MedStar, it was such a great opportunity. Again, as Mark pointed out, I spent 21 years with the Army, running Army hospitals. And every time I came home, it seemed like I was coming home to help deal with the healthcare of a loved one. And every time I sat in the hospital with that loved one, I kept thinking, why don't we do this better? And when I retired, that's what I wanted my second career to be, was to try and make sense of a healthcare system that doesn't always make sense for our older adults. And MedStar very much has that same philosophy with how we treat people. And so it was exciting when I got this opportunity to join the MedStar team and really be part of what we're building down here at MedStar Montgomery Medical Center. So we have a Center for Successful Aging up in our Baltimore practice at MedStar Good Samaritan. And we're bringing those same philosophies down here to MedStar Montgomery, and then we're adding a couple of additional tweaks to it. And so when we talk about the difference in the care that we provide at MedStar, oftentimes our health system turns us into a disease. We're a diabetic, we have cardiac disease, we have Parkinson's, we have Alzheimer's, whatever the disease may be. That is not what we're doing. What we want to do is treat the person, take care of the person, help that person live the life they want, and do our best to help meet those goals. And with that said, we start every conversation with a what matters to you conversation. And so as we work with the patient, with the caregiver, and we look at their needs, and we work with the Ellens and the other members of their care team, we understand that 90% of healthcare happens outside of the hospital. And so we want to have these trusted partners. But while you're with us, when we're providing your care, we have an outpatient that is built to serve the needs of older adults with complex healthcare requirements. So this isn't necessarily the clinic for the well elder that, just needs their blood pressure medication checked. This is for those older adults that have more complex needs, that are starting to show issues with cognition, maybe early onset Alzheimer's or dementia of some kind, whether they've had their first fall, and now we need to engage with groups like Ali and other team members that might be able to help make the home safer, more accessible. And really our goal is to provide and service the care needs so that we can keep you out of the hospital. But should you need the hospital care, it's our doctors, our geriatricians that are taking care of you when you're in the hospital. We have our own geriatricians that are working within the skilled nursing facilities around MedStar Montgomery Medical Center, and also in several nursing homes and skilled nursing facilities around our hospital in Baltimore at Good Samaritan. Our goal is to treat you where you are. Eventually, in Baltimore, we have a home-based primary care practice where we bring the primary care physician to you. We want to bring that same service to Montgomery County over the next couple of years. Our goal within our Center for Successful Aging is to get you the care you need and have you receive an assessment from an interdisciplinary team, which is to say that it's more than just the doctor. You have a doctor, a nurse practitioner, a social worker, a physical therapist, a clinical pharmacist, all engaged in your care to try and decide and help fit what your needs are. And then getting you the care you need through coordination and working with these other team members out in the community, within MedStar, over at the skilled nursing or assisted living. And something unique that we're bringing to MedStar Montgomery that we don't have anywhere else in our healthcare system right now when it comes down to focusing on older adults is a partnership with the assisted living and the primary care managers, where if there is a specific intervention that cannot be provided in that care setting, so if the home healthcare provider is at the house with you today and notes that maybe you need fluids, maybe you've got an infection, maybe you need some sort of intervention that they can't provide, and the next stop would be the ER, we've created an option that would avoid that ER utilization, that would get you to the hospital and get you the care you need when you need it without having to wait in line. But it's a handoff. It's from a care provider to a care provider, whether it's primary care, whether it's the home health care provider, whomever it may be that's assisting at the time, but then getting you that care you need and getting you home. Because we all know when you're at home and when our older adults are at home, they thrive much better. And our goal is to treat you how you need to be treated and as a whole person, not a disease. You are a person. And with that, I'll hand it back over to you, Mark.
Thank you so much, Kurt. And that's fantastic. You know, it occurs to me, Kurt, that many people don't even know what hospital they would be taken to in the event of an emergency, what their local hospital is, and what services that hospital provides. So it's so important, hopefully, that we're located near one of those MedStar properties. But if not, please know who what your local hospital is, what services they provide, and what services that they outsource to someone else. So thanks so much, Kurt. And before I bring up our next presenter, we did have a question, and the question is, what physical coverage does HandyPro cover in this geography, and where are the other HandyPro offices? So if Melissa and Ali would like to answer that live, that would be great.
Sure. Thanks, Mark. We covered the entire DMV area. We covered all the way to Baltimore. We do some work in West Virginia and Frederick as well. So we go about 50 to 70 radius mile from DC. And we have other locations, mostly in Midwest, and also we have in New Jersey. We have one in Eastern Shore in Maryland. That a little further, we have, as I mentioned, we covered Virginia, Maryland, and DC. And also we have some locations in Atlanta, in also in Michigan, and some other areas, mostly in the East and Center.
Thank you so much. So if you'd like to reach out to Melissa or Ali afterward, their contact information is in the chat. And with that said, I'd love to bring up our next presenters. This is a group I met recently. Fantastic service, and it's pharmacy, and specifically it's accessible pharmacy. And I'll let our presenters, Andy Burstein, who's the CEO, and Alex Luzier, who's the Director of Business Development. They're going to talk to you about accessible pharmacy, and you start to see how all these pieces can work together to keep you healthy.
All right. Thank you
Alex
so much, Mark.
and Andy.
Thank you, Mark, and thank you, Steve, and thank you everyone else for including us and for everyone for joining us today. My name is Andy Burstein. My colleague, Alexandra Luzier, is here. We're going to split this 5 minutes. We're each going to share a little bit of information. We are Accessible Pharmacy Services. We're based in suburban Philadelphia. And our company was founded, my business partner and I founded this company. My business partner is blind, and he has a PhD, and he wrote his doctoral dissertation on the accessibility of the top 100 retailers in America. And in digging into his research, we identified the vertical of the pharmacy vertical, and pharmacists in particular, as being the least accessible and the most challenging to people who, whether they're blind, disabled, or older, and just starting to develop cognitive issues. And after a while of trying to do some consulting to some of the big pharmacy chains to convince them to be more accessible, we sort of gave up because we kept striking out. And eventually we were like, let's start our own business. And we did. We launched Accessible Pharmacy Services, and we are a home delivery pharmacy that specializes in the needs of the blind, the low vision, and the disabled community. We are the only company of its kind in the entire country, and we are the largest blind-owned healthcare company in the country. And we do a lot of things to make medication management, diabetes management accessible, less stressful, and to help our patients live more independent lives and live healthier lives. So we do a multitude of things. We have a whole range of accessible packaging. We have a whole range of accessible labeling. And we combine that with a multitude of high-tech, low-tech, and no-tech communication. And we bundle all of this together, and there's no charge for any of those services. And we help people manage their medication better. With that being said, I'm going to pass this over to my colleague, Alexandra, who's going to speak to everyone. Oh, by the way, a quick punchline there. I mentioned we're in suburban Philadelphia. We're licensed in 31 states throughout the country, including DC, Virginia, and Maryland as well. But Alexandra is going to just share 3 examples over the last year of 3 different types of crises, ranging from severe crises to pretty casual crises. But these are all situations where we're able to help support a patient in a crisis situation. So I'm going to put myself on mute, and Alexandra's going to jump in and just share 3 examples. And hopefully these examples will help you understand, like, oh, okay, so that's how I can get support in a crisis situation.
Yeah, exactly. Thank you, Andy. Yeah, so I'm just going to talk about 3 examples of services we provide in different types of crises for our patients. And we provide these services for our patients every day, but more importantly, in times of a crisis. So number 1, we provide at-home COVID-19 testing. So during last year, during the pandemic, we started providing at-home COVID testing. So through home delivery, patients can get their COVID test at their front door and then contact us through our telehealth services to know how to safely and correctly administer the test and send it back to the lab. So this has been a wonderful option for the blind and low vision community, as well as the elderly population during the pandemic and continuing now, so that you don't have to leave your home in order to get a test done. Number 2, we work largely with assisted living facilities. So during a health crisis, it's quite common for an assisted living facility to experience an evacuation. We've had this happen multiple times. We have the capability and the experience of having all of a patient's medication sent the very next day to the place where they have then been moved to. So this way a patient schedule is not interrupted at all because of that. And the last thing a patient needs to be worried about is grabbing their medication when they're being forced to evacuate. And number 3, I'd like to talk about traveling patients. So it's very common for elderly individuals to forget their medication when traveling overnight somewhere, or somebody with a disability to forget their medication when switching facilities or even traveling somewhere overnight as well. So we have the experience of moving that individual's medication to the new location, getting it to them overnight, and getting it handled and delivered to them while they're traveling, so that they don't miss dosages. Once again, it's the last thing that they need to be worrying about, and it's very, very common that it is forgotten. And once it is forgotten, we can get it to them very, very quickly so that they don't miss those dosages. And so it becomes a safety issue. We would love to discuss all these examples and experiences with you further, and how we can assist patients in health crises like these that I've mentioned, as well as others, and assist them in other ways overall. The best way we talk with our patients, our partners, is simply over the phone, the old school way. So we would, just give us a call. Our phone number is 215-799-9900. I will put all this in the chat, and you can always visit our website as well, accessiblepharmacy.com. And thank you for having us. Andy, did you want to add anything really quick before I hand it back over to Mark?
No, I was going to respond to a question here, but we can also, I'll respond in the chat and we can answer afterwards as well.
Okay.
But thank you again, everyone.
Okay, awesome. Thank you.
Thank you, Alex and Andy. Fantastic services. And I'm so glad that everybody is participating. This panel is fantastic. I learned so much from every single individual on this panel, especially this next gentleman I've known for a number of years. And one of the greatest mysteries in the healthcare industry, when people say durable medical equipment, they don't know what that means. And this gentleman, Ashok Kapoor, a dear friend of mine, and is somebody that can help you understand what is durable medical equipment, what does it mean, who needs it, and who can benefit from it. So Ashok Kapoor with DHC Medical Supply and Hawkeye Medical Supply. Ashok.
Hi, Ashok Kapoor from DHC Medical Supply. Thank you so much, Mark and Steve, for hosting this. Glad to be here. So durable medical equipment supplies. This is something that people do not think about as they go about their lives, take care of their sick loved ones or themselves when they come into some ailments. But then when they're discharged from the hospital or nursing home, or when they go to the doctor's office and they give them a prescription for some medical items, may it be wheelchairs, walkers, bathroom safety items, hospital beds, adult diapers, they don't know where to go or what is available. That's why we are there. consider us your consultants to what you need for your loved ones and yourselves to stay home safely and independently, and for you to be able to commute to work and stuff with the medical conditions you may have. That's part of what we do. We have 2 locations, one in Atlanta, Maryland. That's this green flyer that I have, and the blue one in Columbia. We have located in Columbia. These are retail locations open to anybody to walk in, pick up a medical item they need, an item, or be able to talk to us and saying, hey, this is what is going on in my life or my loved one's life. They are having a hip surgery. What would they need when they come out of hip surgery? Hip replacement. They're having a knee replacement surgery. What do you think they're going to need after they get out of it? My loved one is coming home after a stroke. What would they need to be comfortable at home? Do they have everything they need at home to be able to have their adult, their needs taken care of, to be able to go to the bathroom safely, to be able to get in and out of bed safely? What do they need? That's what we provide. So a lot of the items we carry are reimbursable by insurance. So that's one thing we do not need you to worry about. You have a lot of other things going on in your life. So come talk to us, bring your loved one's insurance information, and we do all the paperwork. We file with check to see what the coverage is, let you know if you have any co-pays or co-insurances. We do all the paperwork, the insurance company. If you don't even have a prescription, we will contact your doctor's office and get the necessary prescriptions and medical documentation we need to provide the insurance so we can get the coverage. We, in addition to all the medical equipment supplies that we do, we specialize in 2 things. One, compression stockings. These are lymphedema stockings, so you have varicose veins, you have venous insufficiency, you have diabetic ulcers. We have the items you need to be able to take care of. All of our staff has taken advanced training on compression garments so we can help you get the right fitting. We also have specialized people that have taken specialized training for women going through breast cancer. We can advise them on what is available, what their insurance pays, and what kind of items they need to feel comfortable and whole again. We have external breast prosthetics, we have bras, we have swimwear, we have lingerie, everything that a person needs to live a normal life post mastectomy or lumpectomy. Wheelchairs. They come in different sizes. Hospital beds come in different sizes. Do you know how to set up a hospital bed? Do you know how to use a wheelchair? Do you know what type of shower chairs are available? Come to us. Let us help you, guide you to see what you need. One of the things that we deal with every day is adult diapers. People come to us, say, can you give us your most absorbent underpad? My loved one's diaper leaks all the time and messes up the bed. And what I tell people is that's the wrong question. You should not be looking for the most absorbent underpad. You should be looking for the most absorbent diaper. Once the diaper is leaking, which means the loved one's skin is already saturated with liquid and solid matter. And that's the wrong thing, because that's going to cause skin breakdown. It's going to cause other problems. So come to us, let us help you with hospital grade diapers that are even more economical than the store-bought ones. We are even cheaper than Costco or CVS. We also have nighttime diapers where somebody can stay dry all through the night, 8 to 10 hours. Let us be a consultant, give us a call, come to the store, visit us, or shoot us an email. We can help you out. If we can help you save some headache and keep your loved ones happy and comfortable, that's what we do. Thank you so much for listening to us.
Thank you, Ashok. And we did have a question during that last segment, and the question was addressed to Accessible Pharmacy. So Andy, do you want to say what the question was and address it? Do you want me to read the question back to you on chat?
Oh, sure.
So just so the whole group,
Oh, sure.
hears it?
It says I can't start my video because you have stopped it though, but I can talk.
Oh, well, I didn't. Sorry
Thank you.
about
Someone
that.
asked the question, Paula. There we go.
Yes.
Start my video. Thank you. Paula asked a question about do we have packaging of multiple meds? She was referring to parents may take many meds and organizing it is a nightmare. That being said, we actually are able to package medication, whether it's prescription medication, over-the-counter medication, vitamins and supplements, in pre-sorted disposable pill organizers. And we have different sizes and shapes depending on the person's mobility needs and cognitive needs. We're also able to add a whole layer of labeling on top of that. So we can label all this packaging in with Braille, with large fonts. We also have a collection of talking medication labels, and we can empower an individual to actually have the labels read out loud to them. And we combine that, with a bunch of other things to help walk the patient through the process. But the goal is take that stress off the person's lap of having to organize and sort the medication. And we figured out how to do it for someone who's blind, who can't even see their medication. So, based upon that universal design, it's beneficial to all of our patients, both blind and sighted as well.
Thank you.
You're welcome. Thank you.
And we have another question. Do all these companies accept Medicaid and Medicare? I am assuming that's addressed to you, Andy, and also to Ashok.
Yes, we accept all insurance. Where there's exceptions, we'll work through it with you. But the easiest way to learn about it is to have a conversation with someone from our care coordinator team. We have a team in-house. We try to identify what an individual's challenges are when it comes to managing medication, managing diabetes, managing their pet's medication even, or guide dogs medication or service dogs medication. So we're able to evaluate all that and propose some solutions for the patient. We don't charge anything for the packaging or labeling or delivery. We make our money by billing insurance companies for the services.
Thank you, Andy.
You're welcome.
Hey, Mark, this is Ali.
Sure.
So to answer that question, I think it will apply to us as well. So Medicaid will pay for home modifications up to $15,000 every 3 years. You need to be qualified. It's a lengthy process. And for the Medicare, it depends on their policy. And if they have a long-term disability, they can get it reimbursed. So we can bill them directly. They have to, we bill the client and they will get it refunded through them.
Excellent. Thank you to all those panelists, and we look forward to our next segment, which Steve will introduce.
So our last segment is care in the community, and that could be care at home, or it could be care in a senior living community. And Mark, these are our panel members here. Mark, do you want to call up the one that you want to feature first?
Absolutely. Our first panelist is going to be Roxana Laguerre from Encompass Home Health. They provide home health services, skilled home health, and it's a company that I'm with Right at Home. We work very closely together in the community to keep people safe in their home and thriving. Again, Roxana Laguerre with Encompass Home Health.
Thank you, Mark. Thank you, Steve. Can everyone hear me okay?
Yes.
Okay, great. So yes, I have actually been in the industry for about 20 years, and just a little brief background as to my why story. I had just started in home health back in 2002. And shortly after that, I found out my father had a terminal illness with renal kidney disease. And it was a blessing in disguise for me to start really learning about the industry, because he truly went through a gamut of medical issues. And it was really helpful to have someone in the family to become that navigator. So I've always vowed that I really enjoy being a patient advocate because I don't want people to be in the same situation that I was faced with in a crisis mode. Also, more recently, within the last 90 days, my brother, who's very young, had a very life-threatening case of COVID with pneumonia and now has long-term, long-haul effects from that. He was in hospital over 60 days and he's on disability right now. So especially as we know, COVID has affected so many of us in many different ways. So our goal is to really make sure that patients and families and caregivers understand how to make informed decisions, because we're also faced with doing this very quickly, a lot of times in 24 to 48 hours, if that. So a little bit about what is the purpose of a home health agency? What services does that provide to a patient? Home health is really meant to help a patient who's had a recent medical event. Usually it's surgery or an illness derived from a hospital, or someone may have recently been discharged from a skilled nursing facility, like a rehab center, or someone may have a new diagnosis, even if they're just in the home, or a decline in a medical condition. And basically the goal of home health is to help the patient return back to that prior level of function, get them as much back to normal living as they can. And a lot of what we do is really focused on patient and caregiver education about how do you manage the medical condition that maybe you've just been newly diagnosed with, or as an example, if you're a diabetic, maybe you have a whole bunch of new medications that you need to understand, you don't know how to take them. So we spend time with the patients in the home to teach them how to do that. So the way someone gets home health is, again, usually if it's a hospital or a nursing home setting, that's going to be managed through the team there. Ultimately, it's through the doctor's prescription. But if someone's in the home and they're having like what they call an exacerbation or a decline, if you're going to your doctor's office and you tell them about something that's recently happened, they can, as necessary, write a prescription for that home health visit. The main issue that the doctor is going to look at is what's the diagnosis and what's the goal of the patient. So a lot of times we get prescriptions for fall risks, COPD, now lung disease, including COVID-like illnesses are included in that. Heart disease is a big one, heart failure. Some people call it CHF, or congestive heart failure. Stroke patients often have needs where not only home health is needed, but all the other services that you've heard about, some of the adaptations that are needed. So that ties in well. Also, patients with dementia, Alzheimer's, Parkinson's, or even Lewy body disease. So what do we actually do once we get in the home? Now, it could be a range of a combination of either a nurse, whether it's an RN or an LPN coming in to visit, and a physical or occupational therapist. And in some cases, with people who have, especially with stroke patients who've had maybe a loss of ability to swallow or chew, a speech therapist would be used, but they are also used for other cognitive needs or memory issues as well. So usually the visits are lasting about 2 to 3, they're occurring 2 to 3 times a week in the home, but the actual visit itself lasts about 35 to 45 minutes per visit. So we would do things initially like an initial assessment or evaluation, and that would be ranging from vital signs, checking weights. One of the biggest things that we do, especially when someone's coming home from a hospital or rehab, is review those medications. We want to ensure that they're accurate, because we know that sometimes you're getting new ones combined with old ones. And we don't want anyone to take old expired meds or the wrong dose or at the wrong time. So, and then from a therapy perspective, the visits would range from anything from walking, strengthening, building endurance, and also a lot of patients have difficulty transferring out of bed if they become really weak, or learning how to use, like we talked a little bit about the durable medical equipment. learning how to use a wheelchair properly, a walker properly, or even a specific kind of cane. All those things are things that we do. Another issue is as patients, especially your diabetics, sometimes they're having low vision issues and they need to have a home safety assessment for lighting, and make sure they have clear pathways to walk so that they're not a fall risk, right? And then everyone always wants to know insurance. How does insurance cover this? It is covered by Medicare. That's a national federal law. So insurance is designed to pay for the services as long as the patient's continuing to make rehab goals. You got to continue to improve. Most patients have the service for about 3 to 4 weeks on the average. And if an extension is needed, a doctor can write an order for a recertification. So again, the services are covered by Medicare and at 100% for traditional Medicare. And now there's these new replacement or advantage plans. That's also covered. In some cases though, if you're looking at either a replacement Medicare plan or like a commercial insurance for people who are under 65, sometimes there are co-pays or out-of-pocket expenses to incur with that. So wise, I would say, be a savvy consumer in that regard, always ask. But home health is often an underutilized benefit. So, for those geriatric patients or senior patients, use that benefit because it can be helpful to help them age in place. I do also like to point out, as Mark mentioned, we partner with Right at Home. However, our services are different. Home health is covered by Medicare. We're not the same as private duty home care. So I'll let Mark address that. We're not considered to be the sitter services. Those services are usually designed to take care of things more like daily care, like bathing, dressing, housekeeping assistance, meal preparation. Some provide transportation. So that's kind of where as we like to say, the rubber meets the road. I always like to point out too, again, being that patient advocate, that patients can make their own choice of which home health agency they want to choose. That's also a federal law. You do not have to accept the ones that the hospital says, or even the doctor. If you have a choice, then you want to stick with that therapist or that nurse that speak up. That is patient right. So I think the difference though, especially in more metropolitan areas like the DMV, a lot of times there are just areas that most agencies are focused in on or can only serve, like us. We only serve Baltimore and Montgomery counties and the Eastern Shore. So if we can't serve that area and we get a referral, we will help find the right resource. So that's always important. And that's because Maryland is based on each county has to have a certificate to serve that area.
Thanks,
So,
Roxanne.
Yeah, thank you.
I'm sorry.
I was just going to say one final thing, and it's about timing. The 24 to 48 hour window is the time to get the patient started, mainly because we want to help avoid that patient going back in the hospital.
Much, Roxana. And our next presenter ties in well with the services that Roxana just described and with the services that we'll talk about later under non-medical home care. And that is hospice and other home services. So I have with us our the Vice President of Public Affairs, I can't even say it, Public Affairs and Philanthropy with Capital Caring Health, Mr. Jason Parsons. Jason.
Hello, and good afternoon, everyone, and really glad to be with you. I'm Jason Parsons, and want to talk to you all a little bit today about hospice care and palliative care for those living with advanced illness. Part of what people know, and there are a lot of myths around hospice care, we always try to dispel. People hear that word and sort of, run for the hills. But what it really represents is an approach or philosophy of care that is patient-centered and family-focused, that involves everybody in the family with the person really at the center. And the time for palliative care, we'll start there, which is really around symptom management for people dealing with advanced illness, with a serious illness, who are undergoing treatment for that, but as a consequence of the treatment and the illness itself are facing symptoms that can be palliated or alleviated through professionals in that practice. And it's a really important component of improving quality of life and helping folks' trajectory with their illness really become centered around them and what their goals of care and what their what the outcomes in terms of maximizing their life's quality would be. The other component is begins to encourage dialogue and conversations about wishes and taking a look at what the goals of care are from the center of the person, and begins to ask questions if an illness begins to become life limiting, around not just what your goals of care are, but what are your goals of life. What's on your bucket list? What other things do you want to accomplish? And that becomes really an important component. And as a matter for hospice care, is the definition is if a person is eligible for hospice care, if they have an illness that becomes terminal, life limiting, where if if the disease runs its usual course, the person has 6 months left or less to live. But hospice care really enables people to, as we say, check things off their bucket list, because we really, as I said earlier, focus on the person at the center of care and enable, and a study, for example, from Duke University Center for End of Life Care indicated that people actually live a little bit longer on hospice care with a terminal illness than those that don't. And it centers around dignity and really understanding the values that of a particular patient and their family. Individuals can opt out at any time. And it does not mean, as I talked about myths of hospice care earlier, it does not mean that death is imminent. But it does mean if you elect the benefit earlier than later, you and your family as a patient can receive the full complement of benefits. And one way I often describe to people the difference between hospice care and palliative care is that all hospice care is palliative care, management of the symptoms of the serious illness, but all palliative care is not hospice care. Palliative care is usually earlier in a disease's progression than hospice care, and not all palliative care patients become hospice patients. Hospice care is a Medicare benefit and fully covered in part of the Medicare hospice benefit passed by Congress in 1982. And thank heavens most people that need hospice care are Medicare eligible, older adults. And there are 4 levels of care in hospice care. First is home-based care. And most of our care, it's another myth, people think it's a place you go. And while hospice organizations, care organizations do often run inpatient clinics, which is a heightened level of care I'm going to talk about in a minute, the vast majority of care is delivered in a patient's home, which is where people want to be. And we see increasing evidence of that. So home-based care includes routine home care, which is the most common part. Continuous home care is another form of home-based care, where licensed nursing care is conducted on a continuous basis at home during a short period of crisis as needed to keep the patient home. So they may begin to have a breathing problem, that kind of thing. The other elements are general inpatient and respite care to provide a respite for their caregivers. So it really is about, and in conclusion, a patient-centered approach to provide optimal quality of life for those with a serious advanced illness. So it really a pleasure to be with you. I've enjoyed participating. I was pinch hitting for my colleague, Altanya Garrett, but I've also learned a lot and enjoyed the chance to be with you today. And again, I'm Jason Parsons with Capital Care and Health. Thank you very much.
Thank you, Jason. And like you said, hospice is probably one of the greatest, most misunderstood, aspects of the healthcare industry. And I think that one of the things that everyone on here is seeing is that so many of our presenters today have been affected in their own family or their own personal lives, and they can be more effective in helping you and your family make the right decisions at the right time. And one of those decisions that sometimes people come to make is, mom really can't live at home anymore on her own, or dad really can't live at home on his own anymore, or whatever the case may be. And so one of the great options is a senior living community. And we have with us today two different types of senior living communities. The first I'm going to introduce is Brookdale Senior Living. We have Sarah Herman and Stephanie Lowry, two fantastic sales managers with Brookdale Senior Living in Potomac, and they're going to talk about the Brookdale experience.
Thank you, Mark.
My
Thank
pleasure.
you, Mark.
Good afternoon, everyone. I am Stephanie. I'm here with my colleague, Sarah. We are honored to be representing Brookdale Potomac Senior Living Community today. Today we've been here talking a lot about what to know before a crisis occurs. And myself in my position, and I'm sure Sarah experiences this as well, families tend to, or we find that a lot of families wait until they are already in crisis, or a crisis is already happening, until they want to, or even think about starting to explore senior living options in their area. My regional manager, for example, is very famous for reminding us that no one wakes up on a Saturday or a Sunday morning and says to themselves, you know what, I think I'm gonna go check out assisted living today. Or I think I'm gonna go check out that memory care community down the street. They're not excited about it, and it's kind of on the back burner of your brain in terms of just thinking about it, maybe in the future. But I say, why not? Why not check out your community sooner? Why not take a look at your options? Because it is a part of what you need to know before a crisis. It's part of being prepared for that crisis. Because if you don't start to think about those things, you may find yourself, unfortunately, being forced to make a very major decision while you are already in crisis. So use your resources, like all of these great panelists that we've had here today. Ask your doctors, ask your home health agencies. If you've got home health coming into the house, start thinking about the future and just being prepared, even if it never happens that you move into assisted living or you move your loved one into assisted living, you at least have your short list together. So ask your elder life attorneys, ask your hospital agency if they have places that they recommend. We work with these partners every day. And we're also happy to be a resource for families. You'll be very surprised. You can reach out to a Brookdale representative anytime and find resources for other things that you might need in the community. And check your websites out. I will say that Brookdale, for example, we are the largest provider of senior living in the country. And a lot of people I find in this area don't realize that, but Brookdale has been helping older adults to better manage the challenges of aging for over 40 years. So there's a wealth of information on our website, not just in relation to our community, but even a lot of the resources that you might find with some of these representatives today, and learning more about having the conversation with your loved one, financial planning. So we are always here to help. But I'll talk a little bit more about our community in general, because when you are ready to make that decision, you'll find that there are so many options just within the area. You Google senior living in my area, and I guarantee you 10 or more options are going to pop up. But Sarah's awesome, and let her talk a little bit about Brookdale Potomac specifically.
I could not have said that any better. Stephanie, thank you so much. It's been really, really great to hear everyone, and it's a lot of really good information. But as Stephanie said, we do have a lot of competitors in our area. So, you know, what Brookdale brings to you, you know, besides amazing care, is once you walk into our doors at Brookdale Potomac, and if anyone is ever interested in visiting our community, we would love to have you come check us out. You know, we are the experts. We have a wealth of knowledge. We actually have staff with longevity here, you know, that we promote when people come into our community. That is very important for families to know how long the health and wellness director has been, you know, with the community, or the executive director. With longevity, that gives the families, you know, a peace of mind and security that we are a good community. So my background is in senior living for about 11 years. I started out in home care, so I do know all about that. I worked as a caregiver myself. So when you're coming in and you're chatting with myself or Stephanie, we are very caring, compassionate, and I've actually been through, you know, what a lot of these families are going through, and I'm able to connect with them and guide them in the right direction on what is going to help them out best. So again, Brookdale Potomac is an amazing community. Would love to just chat with any of you guys. If you have any questions, would love to come see the community. We'd love to have you in. I respect home care, but there is a time that you will have to pass them off to your assisted living partners. And I hope that you think of Brookdale Potomac for that reason. And I thank you guys.
And just to clarify, Brookdale Potomac, we are both assisted living and memory care. If you ever have any questions, because I do know a lot of families tend to have a lot of questions in terms of what's the difference. What's the difference between us and a 55+ community, for example, or a skilled nursing facility? And we are more than happy to kind of help guide families through that process.
Thank you, Sarah and Stephanie. Great job. And we have so many options for our folks in the community. And another one of the great options that we have is more of a boutique assisted living community. And we have with us, we're blessed to have Dr. Vina Alfred from Alfredhouse celebrating their 29th year in the healthcare assisted living industry. Dr. Vina Alfred with the Alfredhouse Assisted Living.
All right, there we go. Dr. Alfred, make sure that you unmute yourself.
You're good.
Okay.
There we go.
I said thank you very much for organizing this panel, and also a very good afternoon to my very worthy panelists on this webinar. All of us, all of you come with such wealth of experience. And I want to tell you that Alfredhouse is a group of 10 boutique facilities. And we started about 30 years ago in 1992. So next year in 2022, we will be 30 years old. Now, these 30 years old have taught me a lot. When I started, there were only a handful of group homes in Montgomery County. Now there are so many you can't count. And we are a family-owned and operated business. I'm the founder of Alfredhouse Elder Care. When I started Alfredhouse, for me, it was a labor of love. I wanted to do it because somewhere it was instilled in my heart. I come from India. So women, widows, and children and mothers who didn't, women who didn't have children to take care of them. They didn't have proper homes. So it was instilled in me by my grandmother that when I grow old, means when I grow up, I should open a home for ladies. She didn't think men needed elder care that time. And so in my family, my sons, their wives joined me, and it's a family-owned business. We take care of about 131 residents we are licensed for. And when we started, we did not have as many aging challenges we have now. In those days, the research on Alzheimer's was not so pronounced. People were just finding out how to take care of Alzheimer's patients. But we have grown, learning and developing our skills, and now have a wonderful program to care for all levels of Alzheimer's care and memory care and other challenges that come with aging. It was my vision to create a home-like environment, not a sanitized, there is nothing wrong with them, but my idea was to provide a home. And this is the reason that I started putting smaller homes together and making it very comfortable. And my motto is that if I can't live there, my residents, my elderly cannot live there. And so you walk into any of Alfredhouse facilities, you would love to see the interiors. Our meals are prepared by licensed and experienced chefs. So, and they are delivered in hot cases under regulated temperatures to all the facilities. So the quality of food is controlled. Our caregivers, at this time, we have about 60 staff members. Our caregivers, some of them have been with me for last 20 years. And as I would like our business development VP to join us at this time, Ken.
Hi.
We have services, we can manage medications, we can manage diabetes, incontinence, memory care, dementia care, and transfers for 1 or 2 people assistance, and daily housekeeping, laundry, which we do daily individually, and personal hygiene assistance. And also we have ministers who come to take care of the spiritual needs of the residents. We also take our residents out quite regularly, weather permitting, for field trips. What is our niche? Our niche is for residents who have developed psych issues due to cognitive impairment. We are the only facility, as I know of, who has a multi-sensory room. And that was my passion. I knew what helps dementia patients, especially those who have psych issues due to cognitive impairment. So we have created a multi-sensory room, which does help in diverting the agitation of some of the residents. And I would ask Ken to now continue.
I'm just going to add just a couple of things. Nobody knows Alfredhouse better than Dr. Alfred. A couple of things. One is some of our homes, when we say boutique, and it reflects somebody's home where they're coming from, is you literally can walk into one of our homes into a living room. So you're basically going from one house feeling to another house feeling. And to many residents and families, that's very important, that physical transition. It reminds them of home. I hear that all the time when I'm giving tours. The other thing is, we're kind of dealing and working with everybody that's involved on this panel. And we're all, related in overlap in so many different areas and referrals. And, at the end of the day, we're all working with family members who are very stressed. And it's our role, and I view my role as to hold those people's hands through this process. And sometimes that means we don't get the resident, that they maybe will stay home a little longer, or they may go elsewhere. But the bottom line is that we've helped guide them through this whole process in one way or another. So I think that's important for all of us, but particularly that's kind of our mantra here as well, is to help families through this. It's very stressful for everybody, sometimes more so for the family than for the actual resident. The third thing I would add is that, and many of you are feeling this too, or seeing this, is that although we're dealing with senior care and the elderly, that number is skewing a little bit lower. We're starting to see, early onset dementia in 60-year-olds more and more. So that's something, that I think when we all got into this business, we weren't anticipating at the time. So it's kind of evolving, and I think maybe that's part of the reason why so many new places are coming online, is that there's just a larger universe of potential residents or customers for all of us. So thank you again for this opportunity.
And I do want to add that we have a medical director. Mm-hmm. We also have a psych doctor not on staff, but as a consultant. And on our staff, we do have delegating nurses and CNAs, GNAs, and we are also certified by BCAT, which helps us to keep up to date with the latest information on how to care for dementia residents.
That's it. Thank you.
Thank you, Dr. Alfred. Thank you, Ken Silverstein with Alfredhouse. And thank you to all the other providers. And hopefully, I'm last, but hopefully not least, I am again Mark Ash with Right at Home. And Right at Home is a light home care agency. So I'm going to talk a few moments about non-medical home care because it's often misunderstood. There are two types of organizations that provide non-medical home care. One is a home care agency. A home care agency properly vets, trains, and employs all of the caregivers that provide care in the community. The other type is a registry company which uses independent contractors. So a home care agency could be of each variety. The pricing is different and the way that care is provided and managed is different. We provide non-medical home care. Non-medical home care could cover a number of different things. First being what we call companion care. And in every case, the care is determined by the needs and preferences of the clients that are served. So companion care means that there's no hands-on care being provided. Companion care could be companion and chore services. It could be meal preparation, light housekeeping. It could be transportation to and from medical appointments, running errands. It could be assistance with the grocery shopping. The way I look at it is when life becomes a little bit harder, if you have a little bit of assistance with some of those things that are harder to do, life can become easier and you're able to live your optimal life. So the companion caregiver can assist, whether it's a few hours, up to 24-hour care, or 7 days a week, at a person's level of need. That companion caregiver can help with meal preparation. If you like to cook, they can follow your recipes. They can be your hands and your legs. and you can guide them through your cooking the way you want it. So there's so many different ways that a companion caregiver can help. If you want to go to lunch with the gang, that companion caregiver can take you. Life doesn't have to stop if you're having a little bit of supportive care with non-medical home care. Second is when you can't provide your own hygiene. We had great presenters earlier talking about when you need help with hygiene and so on. When you can't provide your own hygiene, or you can't provide support with their own hygiene, they can't bathe themselves, they can't get to the bathroom properly, or they need assistance with those types of things, that's when a caregiver can provide personal care. They also can help with all the companion chore services, but in this case, they can also provide hands-on personal care to assist a client, again, to live optimally and allow you to stay wherever you are. If you're in a senior community, if you're in a continuing care community, an independent community, these caregivers can come in and assist you in living optimally wherever it may be. Some agencies also can provide a med tech. So if a person can't take their own medication anymore, they need help handling the pills. The pills need to be crushed up and put in their food or whatever it is. In that case, a med tech is necessary. So an agency typically is going to match a caregiver to the needs and preferences of the client based on their abilities. And you ask yourself, well, this got to be covered under Medicare. No, it's not. It's non-medical home care, which means a physician doesn't write a medical order for it. So it's not considered medically necessary, although we've learned over the year of the pandemic that these services are becoming more and more necessary. So non-medical home care can be paid for by long-term care insurance. It could be paid for privately. It could be paid for under a couple of different veterans benefits, including there's a benefit which covers the spouse of a wartime veteran, just to let you know. It could be covered under workers' compensation if a person's injury or illness is a result of a workers' comp injury. It could be covered under a person's auto insurance if that illness or injury is the result of an accident. And it could be covered under home equity or some other form of reimbursed equity in your home or something like that that could pay for care. So I want to give you some examples to tie in everything that we've heard together today and give you some examples of how non-medical home care can support in these types of instances. One, and someone mentioned earlier, Ashok mentioned earlier, and Roxana mentioned earlier, if you've had an orthopedic situation, maybe you broke a bone, maybe you had a hip replacement, you may need help with bathing, with dressing. Maybe you can't drive anymore. So non-medical home care isn't only for the senior. Non-medical home care could be for anyone that's 18 and over that has had a situation like that. Non-medical home care can, like for example, right at home, we provide care, transportation and support to families going through fertility treatments where they can't do anything, after they've had a fertility treatment. It could be maybe you're aging in place and you just need a little more help around the home, that you need help to come in at your level of need. Or it could be in conjunction with an assisted living community where they provide great care and support for you, but maybe you or your family want additional services while you're in that community. It can be provided at that point as well. So I'm Mark Ash with Right at Home, and I'm so thankful first to Steve Gurney with the Positive Aging Sourcebook and creating this platform where we can bring this program to you. I'm thankful to all the presenters that have spent their time sharing information and resources with you. And I'm thankful to be here to be able to speak to all of you. Again, I'm Mark Ash with Right at Home, and we'll take some questions now. Steve, are there any questions?
Yeah, I've got, this is a good question here. And it says, Thank you for this informative and helpful meeting. Are any of the panel members familiar with the spoon feeding law? Our understanding that within an individual person's health proxy, they can state their wishes that they do not want spoon feeding if they cannot feed themselves. Sounds complicated and confusing. Whoops. Somebody answered that. Okay, Melissa, best if you just turn your mic on and answer this question so everybody can hear it.
Yes, can you hear me?
Yeah.
Yes, I sort of answered the question in the chat. I'm not. I mean, I'm obviously familiar with, even from personal experience, with spoon feeding, but I actually think that providers, if they're able to spoon feed, then there's a requirement that they spoon feed. Now, if I've never seen language regarding spoon feeding in an advanced medical directive, but it's certainly something that I would consider adding if an individual has a specific need, you know, or want with regard to spoon feeding.
And typically, an agency like ours, right at home, we can provide a personal care aide who part of their training involves, working with folks that have a chewing or swallowing issue, or folks that need to be fed directly. And I'm going to let Dr. Alfred address this as well. But we are able to, if it is the person's wish or the family's wish, we are able to spoon feed someone. But yes, if their legal documentation specifies they don't want that, then yes, we would have to find other methods, of course. Dr. Alfred?
Yes, thank you. Based on my experience, when a person is not eating, there is a spoon test. You take the spoon to a resident's mouth. If the person opens the mouth, then yes, he's ready to take the food. But what do I do?
Oh, sorry. Just keep on talking. There you go, Doctor.
All right. So at that point, we involve a speech therapist. We ask the speech therapist to come in, evaluate a person who will be able to observe the eating mannerism and whether the person is swallowing and whatever it takes a speech therapist to decide whether this person can be spoon-fed or not, or if there is a problem with the consistency, then the speech therapist will specify the consistency of the food. But that is a line for spoon feeding, not because the family member wants it or not because it was on the most form, but our guidelines come from the physician, from the speech therapist, and that's what we follow. And because we take care of hospice patients, palliative care, we provide that we do spoon feed residents, but again, only under the guidance of the speech therapist. That's it. Thank you.
Thank you, Doctor. Are there any other questions, Steve?
I think we got through all of them there. And but I think the most important thing is the follow-up that we can do to all the attendees with the contact information from all the panel members will permit folks to have one-on-one dialogue with anybody that they heard today. And that's probably the best way to get questions answered.
Thank you, Steve. Thank you all for attending, and we look forward to seeing you all soon. Stay safe and well.
Oh, here, I got one person with their hand raised. Let's see if
Oh,
it's by
good.
mistake or not. It's Nancy Tyler. Nancy, did you have a question or were you just testing out the hand raising button?
Yes, Nancy. Nancy asked me to give my address. My contact information, Nancy, is in the chat, but I'll place it again in the chat
Okay,
right now. And you'll have my contact information.
great. All right, folks. Well, this has been a really good one and look forward to the follow-up, Mark. Great job putting together an amazing panel.
Thank you so much. One sec, let me get that information into the chat
Oh, sorry.
for.
All right,
Okay,
excellent. Okay, guys.
thank you so much.
And I'll make sure
Thank you
that
all for attending.
I'll share that chat and the recording with you, Mark. Okay.